Hi, my name is Deanna Kerberger, and I will be presenting the evidence-based practice PowerPoint today. So the treatment of periodontal disease is being utilized in dental offices every day. Periodontal disease is a disease that is irreversible bone damage around the tooth. So it's basically the structure that's holding the tooth in. Bacteria and different um, aggravators can be reducing what's called the periodontium around the tooth. So in turn, you're getting teeth that are maybe more mobile, and you have to have treatment to get this resolved. It can be anywhere from mild to advanced, and those treatments and surgeries will be discussed in this PowerPoint. So although the disease and the treatment is utilized a lot in dental offices, there hasn't been a lot of studies and trials that have been being able to really figure out what is the best treatment and what are the best protocols for these patients on which stage of periodontal disease they have, and also if they have any type of medical conditions, what is the best type of treatment. So that's why I wanted to do this evidence-based practice around here. And I'm always looking for the best treatment for my patients because I do a lot of periodontal treatment and I help with diagnosis and basically determining what the best treatment is for my patients, and I want them to have a better quality of life and better periodontal health and make them feel more confident in their smile. So that's what this presentation is dedicated to, and utilizing the research that I found to better serve my patients that have periodontal disease and to better implement protocols for that. So the research question that I formulated was, what method of non-surgical and surgical periodontal treatment for patients with moderate to advanced periodontal disease benefits the present and long-term stability and health? So in my PICO, P, which represents the population, it's discussed our patients who have moderate to advanced periodontal disease. Some of these patients do have type 2 diabetes, whether it's uncontrolled and controlled. These patients do range in age for each study, so I did not put that in there. But in other studies, whether they do not have type 2 diabetes, they all have great health. There's no other medical conditions in them. I, for intervention, that is the treatment. So whether it be the non-surgical and surgical periodontal therapy, also the use of essential oils and homeopathic medicine for treatment as well. C is surgical versus non-surgical treatment. That is the comparison, whether there's better results with essential oils or homeopathic medicine as well. And then O is the outcome, and that's finding the best treatment possible for patients who do have periodontal disease. So when I did my literature search, I usually use PubMed as my primary resource that I use. I just find that PubMed is pretty easy to use, and I'm able to find what I'm looking for. When I do my primary articles, I will do the critical analysis primary study, and then also do the last 5 years, and I'll click on free full text, and I'll be able to find what I'm looking for. So the main keywords that I used were dentistry, periodontal disease, periodontitis, which is another word for periodontal disease, diabetes, and alternative medicine. They were chosen with the intent of finding relevant, useful information that I can use to conclude the treatment that is most beneficial. I wanted to find articles that had what I wanted to research on periodontal disease, but also alternative treatments, alternative medicine, different remedies that I could also include in my evidence-based practice presentation. The only thing that was a little bit difficult was because there weren't many studies in dentistry in general, it was a little bit hard to find very specific articles and very specific articles on periodontal treatment, as well as using like alternative medicine, essential oils, homeopathic medicine to actually be able to find what I'm looking for. So in my conclusion, the first study that was done in 2017, this one was just a basic study that had patients with type 2 diabetes versus, who had non-surgical periodontal disease versus those who did not have any treatment. And those who did have the non-surgical treatment, they did have a better quality of life after the treatment done and less than oxidative stress. There weren't many significant findings, though, about the improvement of their periodontal health and their A1C levels. So, to back up that, I did find an article in 2015 that was completed, which patients who had type 2 diabetes, and they did have a increased periodontal health after this surgery, non-surgical treatment, but also they had a decrease in the HbA1c levels to basically benefit their diabetes as well. So that was a huge find, and there has been plenty of articles after that that has also found that with type 2 diabetic patients who have non-surgical therapy, it does decrease their A1C levels. Another study that I found was on type 2 diabetic patients with non-surgical therapy, but in addition to that, there was homeopathic therapy. So it's a combination of different medicines that they take after treatment, and that also showed a significantly better improvement on the periodontal health, along with the HbA1c levels, after the treatment versus those who did not get any homeopathic medicine. So that was another step up from not getting anything at all to getting the non-surgical therapy with the homeopathic medicine as well on patients who had type 2 diabetes. And then also there was a few studies on patients who did not have type 2 diabetes, but they're also very significant in improving the periodontal health. So along with kind of the natural remedies, homeopathic medicine. And another article that I found interesting was treatment of non-surgical periodontal therapy using an essential oil mouth rinse after post-treatment. And that was a study in 2016. And that had a combination of thyme, rosemary, lemongrass, and tea tree oils using as a rinse after the treatment, and that also significantly improved periodontal health in comparison to the control group that had no rinse at all. Another thing that I found interesting was it also reduced the bacterial load in the mouth, so there's specific bacteria that comes in hand with periodontal disease, and it actually reduced that bacteria, which other studies found that it did not. So the essential oil mouth rinse so far has been more of the best solution for the treatment. And then along the root of all these studies containing the non-surgical therapy, which is known to be the standard of therapies, there is patients who have aggressive or severe periodontal disease, and this is to the point where that periodontium, that bone surrounding the tooth, it's been so lost that there's not really much left, and the tooth gets very loose. You have potential of actually losing the teeth. So at that point then, a study that was done in 2019, which was pretty recent, found that doing surgical periodontal therapy instead of non-surgical actually had a better outcome than those who had the non-surgical. And the surgical therapy was a flap of the gum tissue, and then you actually pull it up, and then you're able to see the root surfaces actually clinically, and then you clean them that way. It's a little bit not as much of a standard now. They do a lot more laser therapy, but I actually couldn't find a most recent article about that. So the flap therapy still tended to be the best treatment for those patients with aggressive periodontal disease. So after these studies, I formulated a conclusion in a protocol for patients who present with moderate to advanced periodontal disease that can be implemented in the dental office. So the recommendation of practice that can be used for patients who have mild to moderate periodontal disease should be treated with non-surgical periodontal therapy. In addition, there also can be homeopathic medicine and or using an essential oil mouth rinse post-operative. So these findings were presented through the 3 articles that I found, and those did present that using, whether it be the medication, the mouth rinse, does do a significantly better periodontal health. It increases it than just doing the non-surgical periodontal therapy. Whether it's both, we don't have a study for, so we don't know exactly, but it could be either or. And then the patients who have aggressive periodontal disease will be referred to a specialty periodontist. Most general offices don't have a periodontist in with them, so you typically have to refer them out, and they will have the surgical therapy treatment, whether it be the laser, like I said, or the flap surgery that was done in the study in 2019. Some of the issues that can come forth with the implementation of the protocols would be cost. So essential oils are pretty costly along with the homeopathic medicines. That's going to be an extra cost for the office. So they have to outweigh the benefit versus the risk of buying these products. They have to see, are these patients are actually going to comply? And that's actually my next point is, are they going to actually use these products? Are they going to purchase these products? Are they going to do the extra tasks that they need to do after treatment in order to get the best health out of their gum tissue and be able to heal better? So some patients won't. Usually there are a lot that can, because if it actually helps, then they're going to keep doing it. The other issue that could come forth is that there will be technically less treatment. If you're going to be referring out patients who have aggressive periodontal disease, there's going to be less patients that we're doing non-surgical treatment on, but in turn you are helping that patient better because you're giving them a better outcome for their periodontal disease. So in conclusion, the non-surgical and surgical treatment of periodontal disease will benefit the patient's oral and overall health. As said before, overall health with patients with type 2 diabetes, it will benefit their periodontal health along with their hemoglobin H1C or A1C levels, and also adding other therapies like the homeopathic medicine and essential oils that will also benefit the patient's periodontal health. And here are my references.